Doxylamine is an antihistamine used to treat insomnia and allergy symptoms and is used with pyridoxine in the treatment of nausea and vomiting in pregnancy. In this video, let's found. What is doxylamine? What is doxylamine used for? Contraindication. What are the side effects of taking doxylamine? How does doxylamine work? How to use doxylamine? What is doxylamine? Doxylamine, sold under the brand name Unisom among others, is an antihistamine medication which is used in the treatment of insomnia and allergies. In combination with pyridoxine, it is also used to treat morning sickness in pregnant women. Doxylamine was first described in 1948 or 1949. Several of the first-generation antihistamines, including doxylamine, are the most widely used sleep medications in the world. What is doxylamine used for? Used alone as a short-term sleep aid, in combination with other drugs as a nighttime cold and allergy relief drug. Also used in combination with vitamin B6, pyridoxine, to prevent morning sickness in pregnant women. Contraindication. Hypersensitivity. Side effects. Side effects of doxylamine include dizziness, drowsiness, and dry mouth, among others. Doxylamine is a potent anticholinergic and has a side effect profile common to such drugs, including blurred vision, dry mouth, constipation, muscle incoordination, urinary retention, mental confusion, and delirium. Contraindication. Hypersensitivity. Mechanism of action. Like other antihistamines, doxylamine acts by competitively inhibiting histamine at H1 receptors. It also has substantial sedative and anticholinergic effects. Half-life: 10 hours. Dose: insomnia. Adults and children over 12 years old. 25 mg orally every evening as needed 30 minutes before bedtime. Not recommended for use in children under 12 years old. Upper respiratory tract allergy. Adults. 50 mg orally every 4 to 6 hours. Geriatric. Avoid use in the elderly because of the high incidence of anticholinergic effects. Clearance reduced with advanced age, greater risk of confusion, dry mouth, constipation, and other anticholinergic effects and toxicity. May exacerbate existing lower urinary conditions or benign prostatic hyperplasia. Tolerance develops when used as hypnotic. Safety advice. Doxylamine and pyridoxine are pregnancy-compatible drugs, consistent with FDA's safety assessment of the combination product. They have been categorized by the FDA as a Category A drug, no evidence of risk to the fetus. That's all the information about doxylamine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.